Malawi is a country in southeastern Africa with a population of 18 million, consisting mostly of indigenous population with 10 major ethnic groups who have migrated into different regions. Malawi struggles with poverty and has one of the highest global maternal mortality rates. HIV is a global problem with more than 2 million pregnancies that occur in HIV-positive women each year. It negatively impacts the maternal health in Malawi, where pregnant women living with HIV are more susceptible to causes of maternal mortality. There is increasing evidence that HIV and AIDS-related maternal deaths are escalating considerably, and AIDS is the leading cause of their death in some areas of high HIV prevalence. In this podcast, we'll be discussing how the high rates of HIV in Malawi affects their maternal health, as well as its impact on the indigenous groups. At the same time, our aim is to dissect the issue through the lens of critical social theory to explore the inequalities that contribute to the current prevalence of the disease. There are 1.1 million people living with HIV in Malawi, with 13,000 AIDS-related deaths. About 5% of the young women of 10 to 24 years of age are currently living with HIV. Reflecting with the critical social theory, it is evident that HIV risk among young women is ultimately shaped by socioeconomic and cultural factors. We have included strategies that will reduce HIV transmission among men and women, which would reduce the HIV prevalence rates in pregnant women. The prevalence of HIV rates was not dependent if a group was indigenous or non-indigenous. It was determined rather on the location and accessibility to healthcare facilities. Women in rural areas were less likely to use contraceptives than women in urban areas. Chiwa is an indigenous group in Malawi that make up 41% of Lilongwe's population, which is a large city in Malawi, and there's only a 7.5% of HIV prevalence among Chiwa people. However, the indigenous group Lomwe, who are settled in the northern region of Malawi, has a prevalence rate of 18%. Both pregnancy and HIV incidents occur more often in young women, which emphasizes the need to look at the risk factors that increase their vulnerability to HIV. First is the gendered context of HIV risk, where poverty pushes young women to enter into an early marriage, and the power imbalances usually exist within these relationships, disempowering young women and exposing them to unsafe sex. Therefore, poverty and harmful gender imbalances increase the vulnerability of women to HIV. Due to early marriage and sexual activity, young people are particularly at risk, with about a third of all new cases of HIV infections in 2018 having occurred in young people between the ages of 15 to 24. An issue with the use of condoms is accessibility. There is a low availability of condoms, largely due to the lack of funding. Additionally, young women living in rural areas may not manage to buy condoms from grocery stores due to financial constraints and stigma. There is also a knowledge deficit surrounding HIV prevention and transmission. A study revealed that the majority of young women and men were unable to identify ways of preventing the sexual transmission of HIV. Next risk factor has to do with lack of access to healthcare services. Another key issue is limited HIV testing and treatment services. Most hospitals in Malawi reported a lack of HIV testing kits. Also, HIV treatment services are difficult to access for the rural population. This limited access results in some population having to walk more than 10 kilometers to access services. Knowing some of these important barriers, we have identified some strategies that nurses could implement and advocate for. First is funding. Funding will be needed in order to increase the number of healthcare workers and upgrade infrastructure. Malawi's healthcare system has a shortage of healthcare workers and poor infrastructure, not able to withstand a strain of an increased patient load since implementing Option B+ in 2011. This is a key strategy as it reduces HIV transmission by placing all pregnant women infected with HIV on lifelong antiretroviral therapy. Another important intervention is providing the appropriate education to breach the knowledge gaps surrounding contraception use and HIV transmission. This will empower women to make better educated decisions for their situations. In order to highlight and correct the power and education imbalance for females, it is crucial for policymakers in Malawi to develop and enforce policies that promote education of girls and women. Nurses need to advocate for increase of funding for HIV prevention strategies, such as HIV test services, and increase accessibility by developing more health facilities in rural areas. Despite the advances in prevention and treatment of HIV, there are still too many people with or at risk for HIV that still don't have access to them. Our presented interventions could help to reduce HIV rates in pregnant women in Malawi, therefore improving maternal health status. With our podcast coming to an end, a question we'd like to reflect on is, how do we empower mothers who are HIV positive?